Welcome to TPMG Health Talk. Join us for valuable insights and practical advice on health topics that matter to you most, delivered by our top medical professionals. At Tidewater Physicians Multi-Specialty Group, we're dedicated to providing high-quality, physician-directed care to the Hampton Roads community. Subscribe now and visit mytpmg.com for more resources. Now let's dive into today's episode. On today's episode, we're excited to welcome Dr. Matthew Hopson, a board-certified foot and ankle surgeon. Dr. Hopson was the first in our region to perform total ankle replacement surgery, a procedure he now teaches and lectures on to other surgeons across the country. Thank you, Dr. Hopson, for joining us today.
Oh, thank you so much for having me.
Can you share with our listeners why they might consider coming to an orthopedic specialist at TPMG?
Sure. Just to give you a little background about myself here, I joined TPMG in 2011 and started a comprehensive foot and ankle program with one of our other doctors, Dr. Proto, in the group here. And we take all comers, all ages, and all deformities, all ailments, and basically anything in orthopedics in terms of pain or problems walking or problems sleeping because you're having pain from the day, problems with shoe wear, bad accidents, any type of trauma we take care of as well. So we basically are a one-stop shop for any type of foot and ankle ailments you have.
Now, what sets TPMG apart from the rest?
I think there's two things. I think one thing is that we really spend extra time with our patients and make our patients feel at home and make our patients feel that we know what we're doing, as well as take away that anxiety on those first visits. We also have a full comprehensive array of skill sets. That being said, like I mentioned before, there's really nothing we don't handle. So if it's a complex car accident, we can handle that. Or if it's just a simple, my heel hurts in the morning, we handle that as well. So we're a full spectrum orthopedic practice that handles everything that comes through the door.
When it comes to choosing the right treatment plan, patients often have several options. What advice do you have for them to navigate the best choice for their orthopedic health?
Sure. Well, the first thing is we got to figure out what's wrong. So when patients come into the office, they're nervous. They don't know what's wrong with them. Something hurts, or there's something they can't do, or they can't do a certain sport, or something's going on with them. So when they come in, they're nervous that it could be something like cancer or something massive. So people don't know. So the first thing is you got to set people at ease, knowing that we're going to figure out real quickly, based on diagnostic testing, physical exams, other things, what the diagnosis is and what the problem is the person has. And that's the number one thing to start with. Once we figure out what the problem is, then we can come up with a regimen of treatment options we can go with. Of course, we try everything prior to surgery to get people better and get people back on their feet, but also work with them so that they can still do their job or their activities. If they like to golf or they like to swim or play tennis, we try not to just say, all right, you can't do any of these things until this gets better. Now, sometimes we have to do that, but we like try to work with each individual patient and come up with a specific treatment modality for each individual person, as opposed to like a cookie cutter textbook, every patient's treated the same.
Mm-hmm. When patients are exploring treatment options for foot and ankle issues, what are some signs that might indicate surgery is the best option?
Usually it has to do with something like there's been a previous injury or the complaint's been nagging on for quite some time. We see a lot of arthritis in our practice, wear and tear. So usually if it's something that's been nagging on for quite some time and you've tried some over-the-counter stuff or shoe modifications, or you've maybe seen a different practitioner and it's still there, those are the patients that are most likely going to end up going down the surgical route. Or if there's an acute injury, we do a lot of trauma here at TPMG Orthopedics. And so, of course, a lot of those trauma patients need immediate surgery. As opposed to that, most patients, especially with the newer technologies, there's a lot of new options out there to kind of be preventative for surgery and still get people rehabbed as well.
That's wonderful news. Do you have a particular success story that you could share with our audience?
One of my favorite ones, I think, is going back to total ankle replacement treatment. So one of the Santa Claus and Mrs. Claus here in the area came to me, and Mrs. Claus couldn't do her job anymore because she couldn't stand and walk and be around for the holiday season. And so, of course, we diagnosed her with ankle arthritis, and she ended up going on and having an ankle replacement surgery. And just several years ago, they wrote a big article in the paper about how Mrs. Claus and Santa Claus were able to do their job because they had their ankle replaced. And so, I mean, if you can fix Mrs. Claus, I think you can pretty much fix anybody.
Well, I love to hear those kinds of stories, no matter what time of year it is. Now, you've had patients who have had a certain road where they thought it was challenging. They didn't know they could make it. They thought, this is my life. Now, what do you say to that where patients think there's no hope?
Sure. The one thing I would say is that medicine's always changing. And so we keep up here at TPMG with all the latest and greatest technologies. And so if you're doing things as a physician the same way you did when you came out of training, you're probably missing something. And so I still lecture across the country. I still teach a lot of different procedures and help design different orthopedic instrumentation. And with that, you get to share stories and you get to share kind of treatment modalities with people all across the country, even across the world at some stage of the game. But you also get to be exposed to all the new technology. And then you can start implementing that newer technology into your practice. There are so many different things that I do on a daily basis now that I didn't do even 5 years ago. And there's a lot of different surgeries we do now where the recovery is so much faster due to the technology. For example, bunion surgery is a very common thing we do. And people come in, they have these horror stories about bunion surgery. And actually in the 70s, they used bunion surgery as one of the surgeries to kind of test out new pain medication because it was so painful. Now most patients don't even take pain medication for more than a day after surgery. They can walk that day. 90% of my patients walk immediately after surgery, and they're back in shoes in 4 weeks. And most people can undergo a simple 15 or 20-minute surgery as opposed to a lengthy surgery and get them back to work, back doing their activities so much faster. So that's just one example of something we do so much differently than we did, 20, 30 years ago. And even 5 years ago, I was doing different procedures than I'm doing now, just to get people back in shoes even faster.
Well, you've briefly touched on it. That was my next question. With new technologies and techniques, orthopedic care has evolved significantly to improve patient outcomes and recovery times. Dr. Hopson, can you share some of those innovations more specifically in foot and ankle surgery, particularly those you utilize in your practice that have had the most positive impact on your patients?
So a couple things really kind of stand out, I think. First off is that with the technology of better screws and plates, and anchoring type systems, they're stronger. And that means that we can do more load on the foot when they're stronger. So that means people can walk faster. Also, with newer techniques in types of surgeries that we do, they're smaller incisions. So there's less swelling, there's less pain, less scar tissue. So patients can get back doing their activities a lot faster because you're not doing so much trauma to the foot. And as opposed to doing hand surgery or shoulder surgery, you got to stand on your foot all day. So a lot of people have swelling in their feet and their ankles, and they don't have any problems just from the sheer trauma of just standing on their feet all day long. So we take all these things in consideration. Also, we use so many more advanced techniques in terms of MRI and CT scans for guidance of these types of surgeries, which makes the surgery itself a lot more not only specific, but less likely to. It minimizes error. And when I say minimizes error, you're making it absolutely perfect through a computer, and then the naked eye could not see the slight difference in that type of procedure.
That's so exciting to still be a part of something that's ever evolving. Now, how is TPMG able to keep costs down when it comes to procedures, imaging, and treatment?
Because we're not associated with a specific hospital system, a lot of the diagnostic procedures such as ultrasound, CT, MRI, vascular imaging, all can be done in-house. And what I mean in-house is we have those facilities actually on site. And when it's on site, the payer mix is different and the cost just to the patient is different. As opposed to having these tests done at a massive teaching facility or a big hospital system, it's just the way the world works now, is that you can get the exact same imaging study done at half the cost. So that's one way we keep things down. Also, I think we just are better diagnosticians in terms of diagnosing things, so we don't need to do excessive exams, excessive testing, and we can get right down to the point and the ailment as opposed to putting people through needless tests that they don't really need.
Now, are there any misconceptions about orthopedic procedures that you often hear from patients, and how do you address them?
Well, going back to the bunion surgery we just talked about, I mean, yes, I always have this conversation multiple times a day on what a patient thinks about a certain procedure. And there's just so much stuff out there on the internet. And a lot of times the stuff out there on the internet is either super outdated or it's just flat wrong because the patients were looking at the wrong type of surgery or the wrong type of procedure. So the biggest thing that I try to instill in the patients I see on a daily basis is try to educate them so they understand exactly what they have and understand exactly why we're doing what we're doing. There's always multiple ways to treat a patient or to treat a disease, an ailment, a broken bone, ruptured tendon, whatever it may be. There's always different ways to do it, but I always try to make sure that the patient understands why we're doing it this way and have them be part of the process in deciding how we're going to go about treating that person, because everybody's different. We don't treat everybody the same way for the same ailment. We do multiple different things. It's all based on their activity level, their age, their expectations, their timeline in terms of how long they can be out of work or how long they can be at a sitting job versus standing all day 12 hours on concrete floors. So I think that's one of the biggest things we do that's different here.
You mentioned earlier how anxiety is really common in your patients, and I'm sure many of these procedures, even just coming to an orthopedic specialist, can be daunting. How do you as a provider help alleviate patient anxiety for doctor visits?
I think the first thing you have to do is you have to have a relationship with the patient. So in a very short time, you got to explain to the patient, we're here to get you better, and we're here to explain what's going on with you and to fix or improve on whatever's going on. So instilling the confidence in the patient, I think, is very important, that they are going to get at least better or get pain-free with the treatment we're providing. And also to explain to them that we've seen this before, and quite frankly, we've seen it thousands and thousands of times before, so that they have the confidence in you that you know what you're doing and that you know that you're going to get them to the right goal at the end of the treatment.
That's right. Well, I understand the schedule can vary day to day, but what's the average length of a typical appointment?
I mean, as a foot and ankle surgeon, it just kind of depends. A lot of patients' visits are lengthy because we're discussing a reconstructive type procedure. And then there's other visits that are quicker because it's just we're following up on a physical therapy appointment or a round of medication we gave the patient and see how they're doing with that. So it just kind of depends. It's very fluid. And that's one of the reasons I really like doing foot and ankle surgery and foot and ankle practice in general is just there's so much variety to it. So you're not seeing the same thing every day all day long. So you're seeing all different types of ailments, all different types of personalities in patients, all different types of age groups. I still really enjoy doing pediatrics. I'm one of the few that still does a lot of pediatrics in this area, and I really enjoy it. Having 3 children myself, I can kind of relate. So that probably lets me have a little bit advantage there. But that's also something I really enjoy in my practice as well.
I didn't realize you saw such a variety of age ranges.
Not everybody does. Specifically for me, in my training, I was trained by a bunch of different doctors that specialize in pediatric deformities. So I kept doing that throughout the course of my private practice career, and I still enjoyed doing it, so I never really gave it up. But again, we see all age groups of patients here at TPMG.
What can patients do to set themselves up for success when it comes to post-surgery recovery?
Basically just following the protocol. I mean, it sounds simple, but it's really what I found over the years is that people go into, especially foot and ankle surgery, because of so many misnomers over the past, they're expecting themselves to be in this massive amount of pain, this massive amount of, inability to even get to the bathroom. And what happens is people feel so much better than they thought they were going to feel after surgery. They do too much. And that ends up slowing down their process because they're doing too much early. And then their foot swells because they're on it too much because it feels so good. So just by not going so hard after the procedure and listening to the physician about what really the restrictions are, even though if you're feeling much better, I think that's one of the biggest things to set yourself up for success after a surgical procedure.
I feel like that's so hard in this day and age because everyone is go, go, go. I can't miss a beat. So I bet that's especially difficult as a provider.
Of course it is. However, that's where it comes back to the relationship with the patient. You have to explain to them, look, if you just do this in the short term, you're going to be so much better off in the 6-week, 8-week, long term. You're going to be back to doing the stuff you want to do so much faster if you just slow down in the initial post-operative period.
Well, any final thoughts you'd like to share with our audience here for TPMG Health Talk?
I think just the overall approach that we have here, I think is very special. And I think that, even if you've seen another provider, we're happy to see second opinions here at TPMG. We see all age groups here at TPMG. And also because we have a specialist for every body part, if we have such a collaboration amongst the doctors here. And it's not uncommon for us to pull another doctor into the room that wasn't even supposed to be part of your visit because we think there might be some benefit to seeing that person as well. So there's just a really team-wise approach here at TPMG. So we constantly are referring patients back and forth to each other because you may be better suited for a different physician within our practice that's a little bit subspecialized better than another physician. So it's a really good group of providers here, and we really work very well together.
Well, we appreciate you, and thank you for sharing your insights, and thank you to our audience for tuning into TPMG Health Talk. If you have any questions or want to learn more about why TPMG is the top choice for your orthopedic needs, visit mytpmg.com. Stay tuned for our next episode. Take care.
The information shared on today's podcast is not intended to be medical advice, nor is it meant to replace a professional consultation with a healthcare provider. The opinions expressed in this podcast do not necessarily reflect those of TPMG or its providers and physicians.